We know that there are more and more violent incidences, and much of that is directly related to the nursing shortage.
Police officers in Winnipeg are spending thousands of hours annually inside city hospitals, and those on the front lines say it's a sign of rising tensions in what they say is a broken healthcare system. Data obtained through Freedom of Information laws indicates between 2012 and 2021, police officers in Winnipeg spent more than 1,900 days, equivalent to roughly 5 years' time, responding to incidents at Winnipeg hospitals. Darlene Jackson, president of the Manitoba Nurses Union, says with people waiting many hours for medical care, hospitals are institutions filled with irritation.
Tempers get very short, patients get frustrated, their family becomes very frustrated. So we know from nurses that we are definitely seeing more and more violence in healthcare at this point.
Between 2012 and 2021, police time spent at hospitals peaked in 2019 when more than 269 days were logged, with officers spending an average of 197 days at hospital sites annually over the last 10 years. Jackson says the unsafe environment is one of the issues driving trained professionals away from the province.
This is not sustainable. We have nurses who are leaving the system. We have nurses who are subject to abuse at work every day, every shift, and I think that they need to address this issue as quickly as possible.
While an interview was not granted, a statement from Shared Health indicated safety for patients and staff at all healthcare facilities is of utmost importance and an ongoing focus for Shared Health, saying there are numerous factors behind the police presence at hospitals, specifically Health Sciences Centre, where more than 67% of police hospital hours were logged. As Manitoba's provincial hospital, we know HSC Winnipeg requires particular focus for a number of reasons: its location in Winnipeg's inner city, the presence of both the Psych Health Centre and Crisis Response Centre, and it being the hospital that police predominantly bring apprehended individuals to for medical attention. Shared Health also notes the recently announced Human Resources Action Plan maps out the hiring of safety officers at sites with large emergency departments like HSC. Jackson says while frontline nurses and police have a strong relationship, the province needs to hire institutional safety officers that they promised roughly 3 years ago.
Let's get them into facilities, and that will lighten the load on police, because if we actually have safety officers with some policing abilities, then we won't be calling the police.
As we continue this story, we will speak with the Winnipeg Police to find out what kind of an effect this issue is having on the service. In Winnipeg, Morgan Majeski, City News.